Welcome back to the deep dive. So our mission today is pretty focused. We're talking about that adult quest for, perfect Hollywood teeth,
Mm.
but specifically for anyone over 25 who's staring down the barrel of a correction. And it really comes down to one big question. Do I go for the subtle promise of clear aligners, or do I just accept my fate with traditional braces?
That's a huge debate. And it's really more than just what they look like. It's this tension between adult discipline on one side and raw mechanical power on the other.
Right, because the market is just flooded with brands promising quick, straight teeth. It's information overload.
It is. And everyone just assumes that the clear ones, Invisalign Spark, they must be the better, more modern choice.
But that's not always the case.
Not at all. Especially for let's say, the complexity of an adult bite.
hmm
The research suggests that's often a big mistake.
So we're going to try and cut through that noise for you. The goal here is a shortcut to clarity, really, by figuring out what actually matters when you start this journey.
And the place we have to start, the number one thing that came up in all the research, is this idea of a credibility gap.
Credibility gap.
Yeah. Before you even think about plastic versus metal, you have to decide who is moving your teeth.
Okay, let's unpack that, because when I go to my regular family dentist and they say, hey, we can do clear aligners for you. I mean, they're a doctor. Why wouldn't that be enough?
And that's the core confusion. Look, many general dentists, think of them like your GP. They're great. They might take a few weekend courses, maybe a year-long program, to offer basic orthodontics.
So they can handle the simple stuff.
Exactly. Mild crowding, a few teeth, a little out of place. They're perfectly qualified for that.
But the specialist is a different league entirely.
Fundamentally different. A registered specialist orthodontist, first they do their whole dental degree, then they go back for an extra 3 years of intense full-time university training. And for those 3 years, they study one thing and one thing only: the biomechanics of moving teeth safely. Facial growth, complex bite problems. I mean, they are the heart surgeon of the mouth, not the GP.
3 full years. That is a massive difference in training. So what can that specialist see, say, in that first meeting, that a general practitioner might miss?
It all boils down to complexity, what the sources call the heavy lifting.
Heavy lifting.
Yeah. A general dentist is great at tipping teeth a little bit. That's what a lot of simple aligner cases are. But if you have real structural problems, a deep overbite, a tooth that needs to be pulled down from high up in the gum,
So like major construction work.
you got it. That requires a level of biomechanical knowledge that, frankly, you just don't get in a weekend course.
So the risk for you, the listener, isn't just that the result won't be perfect. It's, what did the sources say? Getting stuck halfway.
Precisely. A general dentist might start a tricky case with aligners, and if the teeth don't move as planned, which happens all the time with difficult movements, they might not have the training to know how to fix it,
They don't have a plan B.
or plan C or D. A specialist, like Dr. Jaideep Sehgal, who was mentioned in the sources, is trained from day one to handle the full spectrum. They can see the complexity coming and plan for it.
I think that is such a critical takeaway. The quality of your guide really dictates the safety of the whole journey.
It does.
And our sources pointed to this clinic, Westbrook Family Dental, as an example of having that specialist right there locally in Toowoomba, so you don't have to, drive to a big city for that top-tier care.
And that's the ideal setup. You want a team with a registered specialist orthodontist like Dr. Jaideep for the heavy lifting. But the sources also noted that the clinic itself is really warm, non-judgmental.
Right, they called it scaredy cat friendly.
They did, and mentioned Dr. Sunham being known as the gentle one. That combination is just gold. You get the high-level technical skill paired with real human comfort.
For sure. I mean, this is a multi-year relationship, right? The atmosphere really matters. Okay, so with that foundation laid, let's get into the main event, the appliance showdown. And we have to start with the darling of the adult world, clear aligners. Why is everyone so obsessed with them?
Well, the pros are, they're huge, and they're all about fitting into your life. Number one, they're basically invisible.
Which is everything if you're in a client-facing job or you're a teacher or just, dating.
For sure. Number two, you take them out to eat. So you keep all your dietary freedom. You can still have that steak, that popcorn, whatever you want.
And brushing and flossing must be way easier.
Oh, way easier. You just pop them out and clean your teeth like normal. No weird little brushes, no threading floss under wires.
Okay, honestly sounds perfect. So why haven't they just completely replaced old school braces? I mean, isn't new technology always better?
That is the million-dollar question. And the answer is that modern technology comes with a hidden cost. And that cost is your personal minute-by-minute accountability.
You're talking about the discipline factor.
I am. It is the single biggest reason why clear aligner treatments fail for busy adults.
Okay, so give us the fine print. How disciplined are we talking here?
The science is totally unforgiving on this. You have to wear them for 22 hours a day.
22?
Not 20, not 21, 22, which leaves you just 2 hours a day for every meal, every snack, every coffee break, plus cleaning.
That's not a lot of time.
It's not. The whole system works on constant, gentle pressure. If you take them out for a 3-hour dinner with friends, that pressure is gone. And your teeth, they immediately start to drift back.
So if I'm a frequent traveler, or I have these long business lunches, or I'm just exhausted and forget to put them back in after brushing at night, I'm basically sabotaging my own treatment?
You are actively working against it. The cost of not complying just compounds over time. You'll find the next tray in the series doesn't fit properly, and then you need what's called a mid-course correction, which costs time and money.
Wow. So that aesthetic freedom comes at the cost of being constantly vigilant.
Constantly. And then there are the other little real-world issues, like the lisp.
Ah, yes.
Many people get a temporary lisp for the first week or so, especially with S sounds, because the plastic changes how the air flows over your tongue. If you have a huge presentation that week, that's a real source of anxiety.
For sure. And what about just losing them? The sources had some pretty funny stories about that.
Oh, it happens all the time. The classic is you're at a restaurant, you wrap them in a napkin so you don't lose them, and then the waiter clears the table.
And they're gone?
Gone forever. And dogs, for some reason, love to chew on them. So you leave them on the coffee table, and you come back to a very expensive piece of mangled plastic.
And replacing them isn't cheap, I assume.
It's not.
Yeah.
It could be hundreds of dollars, plus you have a 2-week delay while the new one is made, which just pushes back your finish line.
So when we talk about cost and time, it sounds like aligners have these hidden variables. How do they compare to braces on paper?
That's a great question. For a pretty simple case, the upfront cost is often very similar. But with aligners, you have these potential hidden costs. The fee to replace a lost tray, the fee for a correction if you weren't wearing them enough.
Which makes braces more predictable, financially speaking.
Often, yes, because it's a fixed system. And in terms of time, for simple cases, aligners might even be a little faster. But as soon as you get into moderate or complex cases, braces are consistently faster.
Why is that?
It's just physics. A metal wire and elastics can generate way more continuous, reliable force than a piece of plastic can.
Yeah.
For the tough jobs, that sustained force just gets the work done quicker.
Okay, let's pivot then. Let's talk about the workhorse. Traditional braces. The name itself just makes you think of, a mouthful of metal train tracks from the 90s.
Right. And we really need to update that image for people. The technology has changed so much. Well, metal is still the strongest, but for adults, the go-to is often modern ceramic options. You get clear brackets or tooth-colored brackets. Even the wires can be coated to be less obvious. They're still visible, sure, but they're not the glaring metal mouth people picture.
But the real superpower, the thing that's a game changer for a busy adult, is what you said before, the zero willpower required factor.
It's fascinating, isn't it? The biggest weakness of aligners, that 22-hour rule, is the greatest strength of braces.
Because you can't take them off.
You can't. Once they're bonded on by that specialist, they are working 24/7. You can't forget them at a restaurant. You can't get lazy at night. For that CEO or that busy parent, that involuntary compliance is a guarantee that you're always making progress.
So if you're being really honest with yourself and you're just not that disciplined with routines, braces are actually the safer bet to get to the finish line on time.
Unquestionably. And of course, they are just flat out better for that heavy lifting we talked about. Serious rotations, big bite corrections. Braces are more reliable, more effective, and faster because they can apply forces that plastic just can't.
All right, so let's do the reality check. What's the trade-off? What are the lifestyle compromises you have to make for that power and reliability?
The compromises are all about diet and hygiene. Hygiene becomes a real commitment. You can't just do a quick brush and floss.
Yeah.
You need special tools. Little floss threaders to get under the wire, tiny brushes to clean around the brackets. It adds a good 5-10 minutes to your daily routine at the sink.
Okay, so it's a time commitment, and then there are the food rules.
The dreaded dietary restrictions. And they're not suggestions.
Right.
You have to cut up hard things like apples and carrots. You have to completely avoid sticky stuff like caramel or toffee. And the number one enemy, popcorn, because the husks can get wedged under the gum and cause huge problems.
So you're basically trading the discipline of the clock with aligners for the discipline of the knife and fork.
That's a perfect way to put it. Both systems demand a sacrifice from you as an adult. It's just about picking which sacrifice fits your life better.
Which brings us right to the verdict. We've talked about the specialists, we've broken down the pros and cons of both systems. So how does somebody listening right now actually make this choice?
Okay, so we can boil it all down to a couple of clear criteria. And it's based on being brutally honest about two things: your bite and your personality.
Let's start with the ideal aligner candidate. Who is that person?
You should choose aligners if, 1, your specialist is confirmed you only have mild to moderate issues. 2, you are genuinely 100% confident you can stick to that 22-hour-a-day rule, no excuses.
Even on vacation?
Even on vacation. And 3, if that near invisibility is an absolute must-have for your job or your social life.
And on the flip side, when should someone really embrace the power of modern braces?
You choose braces if your specialist says your case involves any of that heavy lifting, big rotations, skeletal issues, that sort of thing. Or, and this is the personality part, if you just know yourself and you know that 22-hour rule is just not going to happen with your lifestyle.
If you need guaranteed progress without having to think about it.
Exactly. If you want to set it and forget it, the fixed appliance is your friend.
And I think the most important piece of advice here, the thing that connects back to the very start of our deep dive, is don't guess.
That's the mission statement for this whole thing. The biggest danger is walking into an office where they only offer one of the solutions, usually aligners, and they try to fit you into that box, even if it's not the right tool for the job.
You have to see someone who can do both.
You must see an expert, like the Dr. J.D. from our sources, who is a master of both methods. That's the only way you get an unbiased recommendation that's actually about your long-term health, not just about what they happen to sell.
That makes perfect sense. The expertise is non-negotiable, especially when you're talking about permanently changing your face.
Right.
So we started this looking for Hollywood teeth, and it turns out the whole decision really comes down to finding the right guide and then choosing which adult compromise you're willing to make.
That's it. The complexity of your bite needs the specialist.
Yeah.
And your level of personal discipline dictates the tool.
We've covered the credibility gap, the discipline factor, the hidden costs, but I think here's a final thought for you to chew on as you consider all this. The real deep dive here isn't just about what looks better or what's faster. It's about deciding which part of your adult life you are truly willing to sacrifice to get the result. Are you giving up your dietary freedom? Or are you sacrificing extra time at the sink every single day? Or are you going to submit to the tyranny of that 22-hour clock?
That's the real choice. That's what defines whether you'll succeed or not.
So if you're confused, or you think your case might be one of those complex, heavy lifting ones, and you just need honest guidance, our source material points toward Westbrook Family Dental. They promise they won't lecture you. And with a specialist like Dr. J. Deep on the mechanics and a gentle dentist like Dr. Sonam to make you feel comfortable, it sounds like a pretty safe place to start that conversation.
Go get informed. Go deep.
We'll catch you on the next Deep